Good evening, everybody. My name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment via video calls. So tonight's session is all about trying to prevent shoulder injuries with weightlifting and looking at what the most common mistakes are that people make that leads to shoulder injuries. The things I'm going to discuss tonight is I'm going to have a look at the common training mistakes people make, what the research has shown when they looked at high quality or competitive power lifters in people, what causes injuries for them. Then I'm going to look at 3 of the most popular weight training exercises for the upper body, which is the bench press, the shoulder press, and lat pull down, and how you can tweak them to protect your shoulders or to make sure that you don't injure them as easily. Also, I'll give you some tips and things if you have got shoulder injuries, how you can modify those for specific shoulder injuries to see if you can still train while they recover. Excellent. So if you're new to the live streams, then make sure that you ask any questions you want in the comments. And if you're watching this on replay, then feel free to comment on the video or the link to the video and just tag me, then I'll know to look at it. Very well. So first of all, let's take a look at the most common reasons why people tend to get shoulder injuries. Now, the top 3 that I identified for powerlifters is if they train at too high intensities, if they do the lifts with poor technique, and then also, where's the last one? Lack of concentration. Because if you think of powerlifters, especially at the top of their game, it is really heavy weights that they're lifting, so they have to fully concentrate. So let's take those 3 things one at a time. Too high intensities. Now, lifting heavy weights is not a problem, and the research doesn't show that lifting heavy weights causes injuries. It's about how you get to that weight that you're lifting and about how much volume of training you do with that heavy weight. So the first important thing is, if you're new to weight training, you have to ramp it up really slowly. And it can be really useful to surround yourself with people who've been training for a long time or a good personal trainer to teach you really good technique. And just advise you on a sensible plan of increasing your intensity as you go along. The other important thing to realize is that even top level weightlifters, and especially top level weightlifters who lift really heavy weights, don't just push the weights all the time. They actually periodize their training program throughout the year. And you may have heard me talk about this with my runners that I talk about, and it really counts for all sport. We've got to be looking at our full-on training year, looking at the periods in the year where you really need to peak. And I know the CrossFit guys are really good with this, that they know to take them through peaks and recovery periods. Because remember, exercise causes microtrauma in our muscles, our tendons, our joints, your bones, everything. But then that microtrauma recovers and repairs, and that's the process how we become stronger over time. But if you don't allow enough recovery time and periods of recovery, more than just a day or so, then you can accumulate microtrauma, and that can cause proper injuries then to occur. So the first thing to think about is where you are, how fit you are at the moment, what's a safe volume to be doing and how to ramp that up, and looking at your year of when you're going to decrease, when you're going to increase. So interesting enough, again, with that study that they looked at powerlifters, what they found was that during the hypertrophy phase, where they're looking to build a lot of muscle bulk, they tended to use repetition max of between 4 to 12 repetition max. Now, repetition max for those guys who are new to weight training means the maximum number of repetitions that you can do with a certain weight. So for instance, if I pick up a weight and I can literally only do 1 repetition of lifting it up and then my muscle is tired, that's my 1 repetition max. If, however, I can do 10 repetitions before my muscle says, can't lift anymore, then that's my 10 repetition max. Now, normally, if you want to look to gain muscle bulk, you need to work at a higher or a lower repetition max, so something around 10 or lower even. So for the powerlifters, they found in the kind of the base training phase, they work between 4 repetition max in 12. During the competition phase, they usually worked on a 4 repetition max. The guys who tried to work at a 12 repetition max during competition phase, so where the weights are a lot heavier, tended to be the ones who overtrained and caused themselves injuries. So the training volume is really important. If your intensity goes up, you need to cater with your volume that you bring that down a little bit, that you allow for that recovery. Okay, so then the second thing that causes a lot of injuries is wrong technique. And I mean, I'm going to talk about technique in a little bit for the bench press, shoulder press, and the lat pull down. But technique is so important because depending on where our bodies are when we lift something, we place different amounts of strain through our joints and through our muscles. And to give you an easy example now, let me just make sure I'm in the shot here. If we think of the shoulder joint. Now, if I lift a weight up with my hand stretched out, then that's a very long lever and that causes a high strain in my joint. If, however, I lift that same weight up but with my elbow bent, so there's a short lever, it's immediately less strain in my joint, on my tendons, on my rotator cuff and everything. So we're going to definitely look at hand positions and stuff like that when you really look at lifts. So my best advice there for you would be, 1, make sure when you learn these things, you do it with very light weights, or even just a bar or even no weights, and you get somebody who really knows how to teach you the moves and the positions, and make sure that there's a mirror, because often where your brain thinks that your shoulders and arms and things are moving, it's not actually where it is moving. So you've got to check yourself the whole time. Okay. Then the second thing is watch out for when you get tired, because if you're tired, your technique may suffer, that you don't concentrate that well, or you just can't keep good form. At that point, you have to stop training. Go do something else rather to get some fitness in, because otherwise you will just injure yourself. So technique is really, really important, especially if you're thinking of lifting heavy weights. But it's even important for guys who just do 12 repetition max or 15 repetition max, because if you do enough repetitions with poor form, you will eventually strain something. Now, the third thing that fits in with that is loss of concentration when you're doing weight training. We always look, when we look at a training week and we look at even just one training session, we tend to put the exercises that needs a lot more concentration and fresh muscles towards the start of a training week or the start of the training session, so that you do them before you fatigue, before you lose concentration. Because again, then technique goes, and you just don't think about what you're doing, and that's when accidents happen, or when you just do something with bad form. Hand in hand with that goes quality of sleep. And interestingly enough, with that study with the powerlifters that they did, was they saw that the guys who did regular saunas and had good sleep also had fewer injuries. And saunas and sleep tells me that those guys were really looking at the aftercare. They were looking at themselves holistically. Another 2 things that protected them against injury was the guys who had more years and experience in training as well as competitions tended to get injured less often during competitions and training. And I will say there could be 2 reasons for that. 1, they've got more training years in them, so muscles and things may be stronger. But 2, I think it comes down to experience and technique and knowing how to modify your training and your recovery to optimize your strength there. Good. So then we come on to the specific exercises. Let's do the bench press first. Now, the bench press can be done in 3 positions. You've got the classic one where you're just on your back and you push straight up to the ceiling. So for this, imagine that you're looking at me. I'm lying on a bench and you're looking from me right from the top. Okay, so for the front bench press, you'll be pushing just straight out. Okay. Then you can do a decline one where I'm declined into that position and I'll be pushing there. And then you can do an incline one where I'm sitting upright like that and we're pressing kind of, oh, I'm not doing this very well, kind of like there. Okay. Now, pardon my poor demonstration there. Just go and YouTube video, YouTube guys who are actually doing it on a proper bench press, because I get confused when I look at myself in the camera. So if we think of the position your shoulders are in, there are certain things that they found is better, especially if you've got shoulders that has had previous injuries, that you can decrease how much torque you put on your rotator cuff, which is the main stabilizers, plus the long head of your biceps. So the first thing is how wide your grip is that you hold the bar with. Now, that comes down to lever length and where the muscles can work at its best. So what they suggest is if you take the distance between your two acromions, then your grip should be no more than 1.5 times that. So a quarter this side and a quarter that side out. So roughly there. That puts the least strain on the rotator cuff and your long head of bicep for the stability function. Because you can imagine if you're pushing up, there's a lot of stability going through, or stability action that they've got to work in there. Okay. Now, the second thing is you've got a choice of two grip positions. You can either do the overhand grip, in which case your shoulder is an internal rotation. What that does is it takes the biceps tendon out from underneath the acromion. So if you have issues with your biceps tendon, this may be a better position that you won't get pain in if you have an overhand grip. But it actually takes your supraspinatus tendon underneath the acromion, the bone on your shoulder. So if you have issues with your supraspinatus, that may cause impingement there or pain in that area. So if you have issues with that, it may be better that you train yourself to have an underhand grip. Now that's not a very natural position, but it is something that you can train yourself, but you will have to have somebody to help you spot and get it in the right position. Because what that does is it then just takes your biceps tendon under the bone rather than the supraspinatus. But that does take practice to get it in the right position. Then let me just see, what was the other one that I had there? Okay, so we've got hand spacing, we've got grip selection. Now, if we think of incline, which is seated incline where you just slightly reclined, versus flatten your back, versus decline where you're actually lying with your head lower than your hips. If we're pushing straight up, like in this position, your arm is in neutral, so you're not having any external rotation in that. If you're in a slightly inclined position like kind of that, you've got more external rotation in that arm to not allow it to come off. So it'll be kind of there that you push, but you'll probably be inclined a bit more. Now, the problem with that position is if you have any instability at the front there, you put a lot of strain on your ligaments that runs over the front there, and you're more likely to cause over time, especially if you do heavy bench presses in the incline position, you're more likely over time to predispose yourself to causing yourself an anterior shoulder instability. If you already have issues with anterior shoulder instability, you need to actually avoid the incline bench press. A much better option may be a decline one, because then actually your shoulder is in a little bit of internal rotation, which really doesn't strain that ligament. If we think of posterior instability, so that means that you're too flexible in all the ligaments at the back of the shoulder joint, you may want to avoid bench presses altogether, because there's really not a position that you won't put strain through that. But if you work closely with somebody and you don't go too heavy, you may be able to do okay with it, as long as you avoid the decline or the reclining ones again. Okay, so that is everything I think we need to know about the bench press. So to just kind of recap there, the main thing I would say is don't make your grip too wide. Aim for about 1.5 times this length, so it's this included 1.5, so roughly about there. And then if you get pain with the overhand grip, you can try teaching yourself to do underhand grip, but you likely need somebody to spot you, and that's because it puts a different strain on your rotator cuff and your biceps tendon. The other thing I forgot to say was, if you're getting shoulder pain over the front, something else that you can think about come on camera, focus, is, so imagine again I'm lying on my back, the bench is there, that you don't allow your elbow to drop too far below that level. So try to place something on your, so a rolled up towel or something on your chest that it actually stops you from going below your shoulder height. Or you can try doing them on the floor, that the floor stops your elbows from going back. Because that's quite a common way that I find in practice, that I see people come in and they've strained their shoulders because they've had a heavy weight and it forced their shoulders back too far, or they just did too many repetitions. Okay, so then we go on to the overhead press. Now, the article I read today, really hated it when people went with the overhead press or the military press or any of them behind the neck, in with the bar behind the neck. And that is because in that position, again, we're bringing the shoulder into this external rotation position and we're extending it. Now, any physio will tell you that if you want to test for shoulder instability, anterior shoulder instability, you test it in that position because that's usually where it pops out. Now, anybody with a normal shoulder, don't worry, your shoulder won't pop out. But the point is, if you're doing a lot of heavy lifting in this position, you may over time stretch this ligament and cause yourself an instability or overstrain injury. Again, also in this position, it's quite a compressed position in the shoulder joint, so you're more likely to cause yourself impingements there, and the rotator cuff and biceps head is not quite at the optimal position for them to work at. Also, because of it forcing your neck forwards, it can strain your cervical spine and cause your nerve injuries actually in your neck. So what they suggest is that you do the press at the front rather, that it's over the chest, or if you're using dumbbells and you're doing a military press type thing, that you have it just forwards from your ears, kind of in the scapular plane there, rather than back there. Something else is, again, with regards to the grip, if you have your grip like that, it strains different things in there versus if you have a grip like that or a grip like that. So if you are getting pain in that position, then just move your elbow slightly forward and see if you just change your grip up, what that does for your shoulder, because it strains or it places different parts, different tendons in contact with the bones. But yes, the main thing for the overhead press is watch out that you don't take it behind you, that you come a little bit forwards, or if you want to do it from the chest, you do it from there. And again, if you're doing it with a bar, try not to get that bar too far out, that you actually have it, again, quite a narrow grip with that. The other thing that I would say is if you have shoulders that you've had a shoulder injury, or you're coming back from shoulder instability surgery or something like that, or you have an instability that you're managing conservatively, consider doing these things not with free weights or with a bar, but rather with a machine, so that it's really controlled, that you're building your strength up before you say, okay, now use free weights and try and control it. Okay, so that may be useful as well. Now, lat pull down. So this bit I really didn't actually know. So I don't really like the gym, I guess because I didn't grow up with it and I find it quite boring, the machines and stuff. But one of the machines which you always see when you walk in there, and which I've also used, is the lat pull down machine. And everybody always asks me about whether they should pull it behind them or whether they should rather pull it in front of them. And if my patients have a neck issue, I will always tell them to rather do it in front of them, because behind them it can really force the neck forwards. But what I didn't know was that actually you get a better lat workout if you do it at a 30-degree incline in this position in front of you. So what these guys have shown is that they stick little needles or electrodes onto the muscles, and then they see when you do exercises in different positions what activates the muscles more. And what they did was they looked at lat pull down in the classic position, and they looked at lat pull down in this 30-degree incline, pulling down so that you come to the Ziffy process of the sternum. And that position actually activates the lats, which is the ones you want to work, as well as your retraction, your scapular retraction muscles, better than doing it in this position. So the authors once again feel that, to be honest, you get very little added benefit from doing a lat pull down behind your head. And because of the position that it forces the shoulder into, which is a very compressed position and also strains the anterior inferior glenohumeral ligaments, as well as potentially your neck. If you weigh all of that up, it's better to do the incline ones, 30-degree incline, and just pulling down to your zippy sternum. You can again change where you're getting which tendons makes contact with the bones. By undergrip would be more biceps, overgrip will be more rotator cuff. The other thing that's interesting with that study was that doing it in this position actually had less lats action and more bicep action. So there are other ways to work the biceps. So I would rather say do it in this position where you're declined and you're pulling it to zippy sternum. Good. So that's basically my advice for the day. Top 3 is definitely look at training volume. Periodize your training. Don't just try and push all the way through. You've got to have rest or relative easy periods, and then you've got to, if your intensity is high, don't do a high volume of training. Second is make sure your technique is good. And third is definitely get enough rest and don't do heavy weights if you're tired, because your concentration will go and you're more likely to injure yourself. Excellent. So if you need any help with injuries, you can always consult me via Skype or any other video app that you prefer. You can have a look. The link is in the comments of this video or in the description of the video. And yeah, have a good evening. Take care.